Imagine it's a nice sunny day. The man is walking with his family, and all of a sudden, the man experiences chest pain. He starts to hold his chest and he falls onto the ground. It appears that this man is having a heart attack. Family members call 911 and an ambulance arrives. The ambulance arrives and family members are separated from their patient, and the patient is loaded onto the stretcher and put in the back of the ambulance and taken to the hospital while the ambulance crew performs basic life-saving interventions. Upon arrival to the hospital, the patient is transferred from the stretcher to the hospital bed where advanced cardiac life-saving interventions take place. The family members arrive to the hospital, but they are told to wait in the lobby and they will be given updates on what's happening to their family member. During advanced life-saving interventions by the emergency room staff, the patient unfortunately passes away. At this time, the family is given an update that their family member has died. Today, we're going to discuss why the new practice of medicine is to allow the patient's family member to be present, or at least elements of the family to be present during the resuscitation process. So it was always previous practice to separate the family from the patient during the resuscitation effort. This was mainly because the thought was that the family would be traumatized from witnessing the resuscitation effort and that they should be separated because it would save them from being traumatized from the resuscitation efforts. But according to a study conducted by the New England Journal of Medicine in 2013, families who were present during the resuscitation actually experienced post-traumatic stress disorder and anxiety at a lower rate than families who were separated, which we now know makes sense because families who are separated, more than not, they see their family member and that family member was alert and oriented, walking and talking. And once the family member goes down, this would be the last time they see the family member alive until after, they're told the family member dies after this long journey from having a chest pain or heart attack or whatever medical emergency they experience. So another reason why it was old practice to separate the family members from the patient during resuscitation effort was the belief was that the family would, because of emotional distress, put themselves in between the medical personnel and the patient. And the same study conducted by the New England Journal of Medicine actually showed that family members were less likely to intervene in resuscitation efforts when they were allowed to witness. And actually, the American Association of Critical Care Nurses agreed with this study and went further by saying that if hospitals and ambulance services instituted protocols and procedures what to do just in case, then this would also even strengthen the findings by the New England Journal of Medicine. So basically, this American Association of Critical Care Nurses, what they were saying was, yes, we agree. And actually, if the hospitals write rules and protocols, hey, this many family members can come back here, or leave it up to the social worker to pick a family member to come back here, or on the ambulance, one of you guys, the least emotionally distressed person at the time, can come with us. This will cause the family to have an understanding of what's going on. They would, when they arrive to the hospital, there would be a family member there to say, hey, this is what's going on right now. And this will cause less instance of families intervening. So also why new practice of allowing family members to witness their family member during a resuscitation effort is also allowed because it shows the family that the emergency medical personnel did everything they can for the patient. According to the American Journal of Critical Care, when patients witness the resuscitation effort, they come to an understanding that the personnel did as much as they can for their family members. So to conclude, new medical practice is to allow family members to be present during the resuscitation. It causes less instances of post-traumatic stress disorder, and it allows family members to understand that everything was done for their family member. Thank you.